Carphology, also known as washerwoman's hands, or picking at the bedclothes, is a repetitive and purposeless movement of the hands and fingers, typically seen in patients with delirium or other mental disorders. The term carphology comes from the Greek words karphos, meaning straw, and legin, meaning to gather, and originally referred to the act of picking at imaginary objects such as pieces of straw or other debris. In clinical practice, carphology is often observed in patients with acute confusional states, such as delirium, a condition that causes changes in mental function and awareness. Delirium can be caused by a variety of factors, including infections, drug toxicity, metabolic imbalances, and underlying medical conditions. Carphology is also sometimes seen in other mental disorders, such as dementia, psychosis, and certain types of substance abuse. The exact cause of carphology is not fully understood, but it is believed to be related to the underlying neurological and metabolic changes that occur in patients with delirium and other mental disorders. These changes can affect the way that the brain processes sensory information and controls movement, leading to the repetitive and purposeless movements that are characteristic of carphology. In addition to carphology, other common symptoms of delirium may include confusion, disorientation, hallucinations, agitation, and changes in sleep patterns. Treatment for delirium usually involves addressing the underlying cause of the condition, such as treating infections, correcting metabolic imbalances, or adjusting medications. In some cases, medications may be used to control the symptoms of delirium, including carphology, but these should be used with caution due to the risk of side effects and interactions with other medications. Carphology, also known as plucking or picking at the bedclothes, is a term used to describe a repetitive and involuntary movement of the hands and fingers, as if the individual is attempting to pick at something that isn't there. This movement is often observed in people who are experiencing delirium, which is a state of confusion that can occur due to various medical conditions. The term carphology is derived from the Greek word karphos, which means straw or chaff, and logos, which means study or word. In the medical field, carphology is also referred to as floccillation, which is derived from the Latin word floccus, meaning tuft of wool, or wool ball. The movement associated with carphology can manifest in a variety of ways, but it typically involves the individual reaching out with their hands and fingers, as if trying to grasp or pick at something. They may also exhibit other repetitive movements such as rubbing, tapping, or wringing their hands. Carphology is commonly observed in patients with delirium, which is a condition characterized by a sudden onset of confusion, disorientation, and changes in behavior. Delirium can be caused by a variety of medical conditions, including infections, drug toxicity, dehydration, and metabolic imbalances. The exact cause of carphology is not fully understood, but it is believed to be related to the disruption of normal brain activity that occurs in delirium. This disruption can lead to a variety of symptoms, including changes in behavior, perception, and motor function. In conclusion, carphology is a term used to describe the repetitive and involuntary movement of the hands and fingers, typically observed in individuals experiencing delirium. While the exact cause of carphology is not fully understood, it is believed to be related to the disruption of normal brain activity that occurs in delirium.